I'm going to show you how to check deep tendon reflex. In the last tutorial, I taught you what is deep tendon reflex. Today, we are going to do hands-on experiment. So please stick on this video from the beginning up to the end. I'm very sure that you are going to run a rod. We are going to start with knee-jerk reflex or patellar tendon reflex. Where do we find patellar tendon? Right here, down the patella, that is where there is a tendon called patellar tendon reflex. If you ask your patients to extend, you will feel the patellar tendon gets very hard. So, between the patella, the lower part or the inferior part of the patella, and the tibio-tuberosity, that is where patellar tendon is. Now, what do you do? First of all, you need this reflex hammer, a hammer. What does a hammer do? You just smash something, but we don't smash the patient's body. What we do, we just strike at the tendon. Now, where does this tendon come from? It comes from the quadriceps muscle. What is the function of the quadriceps muscle? It's just the extension of the knee. Extend again. Yes, this is the movement of the quadriceps. So, when you strike here, the reaction will be the extension of the knee. When you check patellar tendon or knee-jerk reflex, the reaction will be knee extension. Let's check. Please, you relax. Relax. Also, you have to see the position. The feet should be hanging at the edge of the table or the couch. So what you do, you just straight the area. Very obvious. On this left one, let us recheck on this right one. Okay, have you seen the reaction? He has not done it willingly. This is an involuntary reaction. So this is knee-jerk reflex. Right now we are going to check the anklejerk reflex. So where is it done? It's done just at the Achilles tendon. Achilles tendon is just the tendon superior to the heel. That is the Achilles tendon. So what you do, you strike with the hammer at the Achilles tendon. Now what reaction will you see? You know, Achilles tendon comes from the calf muscles. When the calf muscles contract, the foot points downwards. Yes, it points downward this way. So that's what will be the reaction. What you do when you strike, you have to hold the foot. When you strike, now the foot will push you downward. Okay? Easy. You relax, don't worry. I'm just supporting the foot. You don't push the foot. You just support it. When you strike at the tendon, you will feel the downwards movement of the foot. And remember, you have to compare both sides. Okay. Now let's go. Now leave it. Sorry. Let's go to another reflex. Which one? You know, biceps. Biceps, it is this muscle. The upper rim muscle, the one that does which movement? When the quadriceps contract, there will be elbow flexion. So you come at just the mid distance of the cubital fossa here. That is where you press your thumb. Then you tell your patients to relax. Please, you relax. You are not relaxing. Okay, what do you do then? You strike at your thumb. Remember, we are checking a normal person. If he's not a normal person, suppose if someone with like the upper motor neuron region would see much reaction, but it's okay with this. This is biceps tendon reflex. Now, there is brachioradialis reflex. Brachioradialis is this muscle that crosses from the lateral border of the elbow and comes and get attached to radius. When this muscle contracts, relax please, when this muscle contracts, we see this movement. So you come just 2 inches above the wrist joint at the lateral, posterolateral area. That is where you strike. You can see from this finger, when I strike, you see already the finger react. Remember, we are checking a normal person. If it's not normal, we will see much reaction. Now, let's go to the last one. We go to triceps tendon reflex. So, like my patient is worried that maybe we are going to strike this posterior part of the elbow joint. It's called olecranon process. No, we are going to strike superior to it. That is where the tendon is. The tendon is from the triceps muscle. When the triceps contract, we're gonna see extension movement. So you put it into flexion, then you strike the area. You see the reaction, the arm comes into extension. So guys, thank you for your attention. You have seen how to check the deep tendon reflex. And please don't forget to place the red button, which is called subscribe, so that you will not miss out the next video or any other video from this channel. May God bless you abundantly. You can see clearly here. To check the deep tendon reflex, use this tool. It's called the reflex hammer. Then when you strike the reflex, when you strike or hit the tendon, the impulse will be conveyed through the afferent nylon and go and pass through the spinal cord. And then there will be 2 pathways, the inhibitory pathway and the stimulatory pathway. Let's first of all see the stimulatory pathway. Here is the alpha motor neuron that goes and stimulates the quadriceps muscle. So when the quadriceps muscle is stimulated, it will react. Remember where the reaction came from. We hit the patellar tendon, then the message will go through, or the impulse will go through the afferent neuron. Then the afferent neuron will stimulate the alpha neuron, the alpha motor neuron of the quadriceps. Then the alpha motor neuron will go and stimulate the quadriceps and make it contract. Meanwhile, the inhibitory pathway will go to inhibit the hamstring muscle. But before we go and see clearly what happens, let's go through this anatomy of the cross-section of the spinal cord. There are 2 parts, the lateral ones, that is the left one. There is dorsal horn. Do you get it? There is the central canal. The same way on this right side. So here we are checking the right side. Here is the left side. On both sides there is dorsal and central horns.